Hello everybody, my name is Arthur Kwizera. I'm an anesthesiologist in Kampala, Uganda. The other things I do is that I'm a senior lecturer at the Department of Anesthesia and Intensive Care at K University College of Health Sciences. So with regards to anesthesia and intensive care in Uganda, there is a lot that is going on. The Association of Anesthesiologists of Uganda and the Intensive Care Society of Uganda, both of which I'm part of, are actively engaged in trying to resolve issues with regards to perioperative care of our fellow countrymen, postoperative care, and also intensive care or acute care. We at the Department of Anesthesia at K University have spawned the development of an emergency medicine program, as well as bred some really bright and young anesthesiologists who have gone on to do very great things for this country's perioperative and acute medicine aspirations or strategies. What we are doing right now is that we are currently engaged with growing Uganda's intensive care and capacity. With this background, we've chosen a path where we've reviewed the curriculum of anesthesia specialist training to heavily embed the component of intensive care, because not everyone can go have a fellowship in intensive care medicine, and yet we need anesthesiologists or the anesthesia provider to be able to handle the acutely ill patient in a dedicated environment. Some of our colleagues have developed bachelor's in anesthesia program, which is happening at one of our sister universities, which is Bukoto University. This will help us build the capacity that we need to provide intensive care services at our regional referrals, district hospitals, as well as health center force. We've also been involved in creation of a critical care nursing program, but the idea is to train at least 1,000 nurses for the country who will be able to provide acute and intensive care at our regional referral hospitals. Members of the association have been involved in the creation of Handsoff. Handsoff is a national strategic plan for surgery, obstetrics, and anesthesia for the country. And in this regard, every patient, we believe, at least 95% of patients will fall under this category within the Ministry of Healthcare Strategic Plan. In other respects, some of our members are part of the National COVID Task Force, advising the government and helping the Ministry of Health prepare guidelines for treatment of patients with COVID-19. And to date, the government has committed to building at least 18 new intensive care units at the regional referral hospitals, and every intensive care unit will be at least 10 beds. Members of the Department of the Anesthesia fraternity have been involved in helping quantify the oxygen delivery and oxygen needs of the country as well. In addition to that, members of the fraternity have been involved in, at the global level, being part of expert panels at the World Health Organization, advising and contributing to interim treatment guidelines for sepsis, for influenza, as well as COVID-19. One of the other things that the association is involved in is in helping build capacity and working with the Ministry of Health for more anesthesiologists such as myself and others to be trained and skilled in the art of life-saving medicine. We believe that with every regional referral hospital having at least 6 or 7 anesthesiologists and health center force having at least 6 or 7 bachelor's degree holders of anesthesia, we can reduce maternal and child mortality and infant mortality by at least 50%. The Association of Anesthesiologists is involved in research. Many members of the association are publishing work and doing research in ways that can ably inform not just the government of Uganda, but the World Health Organization and other governments in improving perioperative, postoperative, and intensive care of the patient wherever they might be. Everything that the association and the members of the association have been trying to do, have not been without the great help and support of partners. The principal partner in this endeavor is the Ministry of Health of Uganda. The Ministry of Health has been able to provide scholarships to our trainees. The other significant partner we've had that is actually working with us right now to improve intensive care and perioperative care is Gradient. They assist in the innovation and creation of an anesthesia machine that even the lowest cadres of perioperative medicine can use. The machine is called the UIM. And not only they do that, but they also went ahead and helped the development of the critical care the acute care or critical care ventilator. This ventilator is affordable, reliable, and can also deal with the vagaries of the environment of this setting. We have other partners like the Association of Anesthesiologists incorporated in Ireland that have played a huge role, especially with sponsorship of trainees. We have partners, global partners in anesthesia and surgery. It's an American-based organization as well. So I want to say thank you to these partners. We encourage other people or organizations that would like to work with us to build anesthesia and intensive care capacity in Uganda to reach out and have a conversation with us about how best we can do this. My name is Arthur Kwizera. I thank you so much.